Post-traumatic stress is far more common than many people realize, and we're here at Harper Therapy near Tampa, Florida, a facility which uses a remarkable treatment called Accelerated Resolution Therapy, or ART, to reprogram how the brain stores traumatic memories and imagery. Joining us to discuss is Kelly Breeding, the Executive Director of ART International. Thank you for having us, Kelly.
Thank you for having me.
The National Institute of Mental Health says that as many as 1 in 11 people suffer from post-traumatic stress disorder at some point in their lifetime. That's roughly 8 million people in any given year. Is it seen as a weakness to say, I need help?
Unfortunately, it is. There is a negative stigma attached to mental health, seeking out mental health treatments, which is unbelievable to imagine that in this day and age with things that are happening, but especially with the veteran population or active duty military population.
The men and women of the U.S. military are trained to not show signs of weakness. This makes reaching soldiers who are suffering more difficult, as they often don't seek treatment.
Brian thought the physical ailments he was suffering after leaving the military were related to blood pressure or diabetes. Instead, he was diagnosed with PTSD.
And I got to this point where I was in the National Guard and I went for a 2-week drill and I had a major panic attack. And they sent me home early. And a couple of days later, a friend called me up and said, hey, they're doing this therapy at the University of South Florida. You should really go down and try it.
ART is results-driven and so effective that Brian created an organization to bring awareness to his military brothers, sisters, and their families to help with PTSD and reintegrating with society.
Honestly, it's hard to get a veteran into a counseling session. So we surrounded it with a lot of physical fitness and yoga, but accelerated resolution therapy was the very base of the Veterans Alternative, which we launched on November 11th, 2014.
In every community across the nation, we have first responders that are experiencing these traumatic events in their own home, in their own neighborhoods, in their own towns. That's obviously something that is really prevalent for us. And then people living in their everyday lives.
They may have lived through a natural disaster, been a victim of or witnessed a crime, or any number of other traumatic events.
The statistic of 8 million people diagnosed with PTSD in a given year is strictly based upon those who sought treatment. The actual number is estimated to be much higher, which means that many people struggle on their own.
The mass shooting that happened out in Las Vegas a couple years ago, and there were a lot of people involved in that are suffering from post-traumatic stress. They have survivor's guilt.
PTSD is not a one-size-fits-all diagnosis. There are many levels of trauma which affect people differently. Survivor's guilt is a common example.
They feel guilty seeking out treatment because who am I to go? I'm alive, I'm here, and it didn't directly affect me in that way.
Panic attacks, anxiety, depression, combativeness, and isolation are all symptoms of PTSD.
There's so many different symptoms, and it's very individual per every person.
No one is born with post-traumatic stress. It's a reaction to events in life. Sometimes a trauma may take years to surface and can be triggered by anything, like the color of a shirt or seeing a random object on the side of the road. Other times the effects are immediate.
We have people that lose loved ones in a way that was very unexpected. I have somebody that I spoke to yesterday that lost their father very unexpectedly last week, and they're really struggling.
When trauma affects your daily routine or impacts someone's quality of life, that's when the diagnosis of PTSD is used.
Accelerated Resolution Therapy, or ART, is a procedural-based, trauma-focused therapy. ART uses eye movements, which creates bilateral stimulation.
We all have memories. All of our memories are very malleable. Every time you recall a memory in your daily life, you change it a little bit and then you file it back. Well, when you have a memory that is attached to a traumatic event, it has a physiological response on your body. So you think about this moment and it causes rapid heart rate. It can cause you to be, nauseated. It can cause people to become very, very emotional. So by recalling that memory and going through these eye movements, which is basically the reconsolidation period, you can allow the person to become the director of their own memory.
ART patients attach new images to existing traumatic memories in order to change the body's reaction to them.
Now, the person still recalls that memory the way it was, but it doesn't affect them in a physiological response.
One of the benefits of ART is that the patient isn't being re-traumatized by verbalizing their experience to the therapist. Instead, they're recalling the memory within their own mind as the clinician runs them through a protocol with guided imagery.
But they're not being re-traumatized by having to tell their story over and over.
ART benefits the clinician as well by reducing burnout.
The therapists help patients in identifying the physiological responses that are happening and use metaphors to assist them in processing out the body's response. This essentially provides a mental roadmap to healing.
1 to 5 sessions is what is generally requested or required of somebody. Now, everybody where they fall in that spectrum is different. It depends on your type of trauma. It depends on the amount of physiological responses that you're presenting with. And it depends on a lot of traumas are complex or they're compounding. So if you've experienced something as a child that was traumatic, it can often lead people down a life where they are putting themselves in riskier situations.
With ART, there is a resolution at the end of every session, and patients work on one experience at a time. The average is 4 60 to 90-minute sessions.
There's a beginning, middle, and end of every session of ART, so you're coming to a resolution and you're working on one experience at a time.
In the final session, the patient is taught how to utilize the ART tools they've learned without the guidance of a therapist.
It's very empowering for the client because they're actually physically doing all of the work internally rather than, they're told to take a book home and read it or write in a journal about their feelings and then come back and talk about it. Like they leave the first session with a huge relief.
Upon first glance, an ART session may look like a form of hypnosis, but it's actually a fully conscious mental and physical exercise completely unrelated to hypnotherapy.
Kelly gives us an example of a memory of a patient that was placed in foster care and through ART is able to turn that negative memory into a positive one, where they get to choose the life they want.
That last memory often of being removed from their home and their belongings being placed into a garbage bag can stick with somebody and it can affect their trajectory through their life. And so if you could take that person at that moment and have them go back to that memory and maybe a silly metaphor I've heard used is that the child goes to a parent store and they're able to go pick out a new set of parents that would be the perfect set of parents that they would have. Even though they know that they were still removed and placed into foster care, that new memory is what they're going to think of. And it changes the emotional connection to that memory and the emotional response that your body has.
ART is utilized by around 1,500 therapists in the U.S., Europe, and Canada. Yolanda describes ART as a perfect solution for traumatic memories by providing hope, growth, and healing.
Before ART training, Yolanda was having a hard time helping some clients achieve the results they were looking for.
And then once I was trained in ART, just phenomenal results after short, brief sessions.
ART was founded 3 years ago after a study at the University of South Florida's College of Nursing showed promising results.
Beyond treating PTSD, ART is also useful for working professionals, in military applications, or by athletes as performance enhancers.
Anybody who's struggling, you think about a kicker who maybe has missed a field goal for 3 games in a row. Well, he's going to go out on that field and he's really struggling. So you can work with him to help him enhance his performance.
ART not only helps patients deal with traumatic events from the past, but allows them to build new skill sets moving forward.
And then with the eye movements that are unique to accelerated resolution therapy, they're able to practice these new ways of being. They're able to practice new patterns in their daily lives, new ways of interacting in their relationships.
Yolanda herself has used ART to help her with confidence in stage presence before giving a presentation.
Whereas before that session, I was like a dog with a bone, just kind of replaying in my mind. After that session, I was just feeling totally comfortable and confident with being able to give that presentation and know that the message would be clear.
Accelerated resolution therapy is changing people's lives through treatment allowing patients to heal without being re-traumatized. If you or someone you know is suffering from PTSD, visit artherapyinternational.org for more information.
Thank you so much for being on the program and doing all that you do within the community using ART.
Thank you.
Thank you.